Welcome back to Practice Underwater. I am here again with Scuba Steve. And Scuba Steve and I, we have gone deep last week. And, if you didn't listen to the episode last week, I'd recommend go back and take a listen. Practice Underwater is always fun because I always like to start with understanding the story of how somebody got into ownership. And I really do think that Scuba has a very unique story on how Scuba made its way into ownership. And so I'm going to kind of just use a few minutes here to kind of recount that. And then once we're kind of caught up to speed, then we're going to get back into it. So if you haven't listened to the episode last week, I'd encourage you to pause this recording, go back to part 1 with Scuba Steve and listen to the full episode. But let's just say you choose not to do that, or you listened and you just wanted a little reminder. I'm going to kind of go through it and give you an update or just a recap on that episode. So our guest, Scuba Steve here, graduated dental school in 2018. And initially went to an associateship, great office, great job, super busy, just like an abundance of patients, really doing a ton of dentistry, and really enjoyed it. And for 5 years, had a great time. Well, 4 years, had a great time. And then I think the corporate element started kind of coming up, like pushing production, being told what to do, all the stuff that people sometimes complain about with corporate dentistry. That started coming up into Scuba's life. And Scuba made the decision, I have to leave. And so then there was like a kind of a final year that wasn't ideal, a lot of phasing out. And Scuba ultimately decided to go back home where they have family. And Scuba ultimately got into an office, and this office was really unique. It was a fee-for-service practice for like 50 years. And the dentist, who was like the longtime owner, had actually sold it to about a Medicaid DSO maybe about a couple of years ago. And so there was a little bit of a work back period, but Scuba never met that original doctor. But one of the things that Scuba talked about is like the quality of dentistry that he walked into was like really high. And so the office historically had done between $500,000 and $700,000 in collections. And, Scuba came in and there was a lot of chaos. Like a lot of like team members were turning over, not a lot, but like there was 3 team members and 2 of them turned over. And so there was really like just not a lot of stability. And, we had a new hygienist now, we have a new assistant, we have a floater. And so Scuba has like a 4-person team now. And the interesting thing is I spent some time on the analytics during our last episode. And the thing that I noticed is Scuba walked in, and something that happened right away was like the initial bump. So, that practice doing 500, 700,000 per year in collections all of a sudden was doing about 90 to 100,000 a month, pretty much instantly. I looked at the last 24 months of Scuba's ownership, and pretty much consistently, Scuba has been doing that like $1.2, $1.3 million per year pace. And, so Scuba is now doing about 1.3 million, about $500,000 a year take home. And, I in this whole episode last week, I'm trying to figure out like, where are we going? Like, what's like, I got to get the treatment plan. That's my job in part 1. And, so then I kind of very directly asked Scuba on the last episode, I'm like, okay, where are we going? What's the goal? And there was kind of like a fork in the road that Scuba sees. It's like, do I run the practice the way that it is? And do I kind of stay this old school, like, patient provider, like relationship, maybe old school dentistry? Or do I try to go more new school with multiple doctors and expanding the location, having multiple hygienists, maybe a provider and a half, and, like a doctor and a half, maybe 2 doctors, that type of thing. And my instinct that kind of I talked to Scuba about is like, I think that, we talk about in our precision growth pathways, we talk about taking things in stepwise progression, and Scuba is a fee-for-service office. So like collections-wise, we're looking at a productive solo, but I would say like infrastructure-wise, we're at a solo. And I think Scuba spent a lot of the first 2 years of ownership like surviving. And I don't know if we spent a lot of time organizing and systematizing. And so I think that that's like the next step for Scuba is to get the practice to feel different. And then Scuba dropped this bomb on me to end the episode. And this is where I want to start, which is Scuba works Monday, Wednesday, Thursday. And then on the Tuesday goes to another office about once a month, once every couple weeks, and does oral surgery only. And Scuba talked about how when he walks into that other office, he gets this great feeling. And when he walks into his practice, he gets this feeling of, I don't love my practice. And one of the things that I really emphasize in all of my lectures, podcasts, everything is, private practice, one of the things that's so beautiful about it is it's your private practice, right? You get to make it what you want, and you don't need to have like this prescription on how to do it. And so, like, honestly, this is the where I want to start is that I don't love my practice. Like, why do you not love your practice, and what can we do to make you love your practice? So, like, that's Scuba. Welcome back to Practice Underwater. Welcome to part two. And I'm just dying to find out. What do you not love about your practice?
Hey guys, I survived the last week, so we're good. Um, it's hard. I mean, it's just a gut feeling, but I think it's a combination of the team before I got there, just going through so much with the other owner transition, the other new owner, me, turnover in the team, and then I come in and hit the ground running numbers wise, but also there was a lot more on the team because we weren't part of a DSO anymore. I mean, we had to do a lot more in house and try to get those systems in place. They did amazing. It was awesome, but I think it was harder on them than I thought. And what I think we need to start focusing on is making sure they understand like my goal and visions and making sure it aligns with their goal and visions. Because unless we have the same vision, I mean, we're never going to be on the same team. So I think that's going forward, something I need to do. I also think I undershot the landing. Having four team members is wonderful. We don't have a lot of drama. We don't have a lot of drama, which is great. A lot of drama with a huge team, but then we also don't have like the fun lunches where we go in there and everybody's like, a bunch of energy thrown around, having a good time. I also think a lot of it is due to me needing to grow the practice or patience so fast that we were kind of taking almost anybody in that would just randomly walk in from the streets. Like we even thought about changing our name to Crazy Dental because that's how we felt sometimes, just kind of all over the place. And that is a lot on the team too, because if we don't have patients that have the same vision as us, it's hard to treat them. And even though clinically I know how to treat these people, I think more mentally it was a tough match. And that's hard on the front desk for scheduling and collecting. And, sometimes these patients were rude or didn't want to do things with the way we wanted to do it. So I think a huge bonus of growing a business is also having the freedom of not treat everybody in the world. And that helps the team a lot as well.
So, Scuba, I want to, before we even dive into any one thing, I use an expression sometimes on meetings where I say, let's take the bucket of crap and dump it on the table so we can see the whole mess. And so, like, let's take the bucket of crap and dump it on the table, right? You have team chaos and a lack of organization. That's one thing. You have this, like, energetic feeling in the office that you've kind of described of, like, the energy and the vibe. Then you talked about your goals and vision. Then you talked about the patient base and not necessarily screening for your ideal patients. Anything else that you don't love about your practice, we can just dump it on the table now, and then we'll go through them kind of one by one.
Um, Initially, it was definitely the technology we had, but we upped that, really fast. I think where we're at technology wise is good, but there's still some work to do with the business itself. I mean, up until 2 weeks ago, we still had like bleach stained carpet in the operatories. And even though everything's clean, it doesn't look clean. And it's hard to give someone, a big treatment plan for comprehensive dentistry when they're looking down at the floor and seeing stains in the carpet or looking up at the fluorescent lights and seeing like dead flies in there. So we're a lot better like with the office setup, but initially I think I had a lot because I would walk in and just be like, oh my God, like this is tough for me to see.
Do you think your practice is ugly?
I did for sure. I mean, I bought the practice, the building about a month ago. And in that month, I mean, we just did everything. We got new hardwood floors, painted. We got rid of the fluorescent lights. We did the ceilings. Before that, I couldn't change anything though. So every day walking in, I felt horrible. And it's tough to get dead flies out of a fluorescent lamp. I learned that for sure.
Do you still feel like when you walk in now that are you done doing the work, or you have more stuff you're working on?
We're at where we need to be for now. Like I would love to do a full, remodel, but we're definitely where we're at now. The problem is it's a 250 and a half year old building, and I don't like old buildings. So I think even with it being perfect, beautiful, awesome, I'm still never going to walk in and say, I love this building.
Hmm. What about the interior?
So the exterior is amazing. It's beautiful brick building, flowers, whatever. The interior is what I just hate. It's just very much a house still. I mean, there's wallpaper still, stuff like that. It's kind of caught in between. Are you a house or are you a dental office? And it's hard renovating some stuff because I don't want the inside to look like a spaceship because that would be weird. I don't want it to look like a modern sterile lab of a dental office. I definitely want to treat the building like the historical building it is, but at the same time run an office there, and it's really tough.
Okay, so let's keep kind of going here down the list. So, anything else? I've got the energy, I've got the building, the aesthetic, the patience, the goal, the vision, the team chaos. Anything else?
Yeah, I mean, definitely just more systems. I don't think we really have any systems, and one is just because I just haven't put them in place. Two, we have an amazing team, but we only have one of each. Like we can't really have a lead hygienist because we only have one hygienist.
Yeah.
So it's kind of hard to put in checks and balances when it's just like you got a hygienist and then you got me. So then I find them coming to me more than they should, but they really don't have someone else to go to yet.
Okay. I got systems written down. Anything else?
No, and as far as the energy, I meant I like crazy fun energy, but we're kind of more just dull energy.
Do you think that's the team members' personalities?
I think it's the fact that we're a very mature team. So overall, it's good, but it's crazy to say. Like I almost miss some of the drama. Like not, it's weird. Like obviously, I don't mean that, but I almost miss some of that energy and drama. Like we're so mature, it's kind of boring sometimes.
Yeah. So, okay. So now I'm going to make a list, and I want to do a ranking system for you. So, like, I have here 1, 2, 3, 4, 5, 6. And so I'm going to list all 6 of these things, and then I want you to rank them in order of 1 to 6. 1 being like, this drives me nuts. 6 being like, I get it, but like, I got bigger fish to fry. So we have dull energy, team chaos, your goals and visions not aligning, the patient base that you're treating, the look and aesthetic of the building, and the systems. So I'm going to start with the dull energy, 1 to 6. Kind of where would you rank that? Or maybe why don't we start with 1 through 6, right? What's number 1 on the list? Like, what's the thing that drives you nuts the most?
I would have to go with the building because I know that's going to be 100% every day.
Okay. So the look and aesthetic is
Yeah.
number 1. All right. Number 2.
I would say vision.
Okay.
And that is for me, for the team, but also for the patients.
Got it. Number 3.
I would say systems.
Okay.
We got
4.
building. Yeah, we got building, vision, systems. Where's the other three?
So I got dull energy, team chaos, and the patients, the not treating your ideal patient.
I would say it's almost 5. Like I would put not treating my ideal patients and visions in one.
Okay.
But
So I'll put it as 4 on my
okay,
list, and then the team chaos and the dull energy. Which one is the more annoying of the two?
I would do dual energy.
And then the team chaos is it's kind of lumped in with systems. Okay. All right. So I'm gonna take them in order. And you seem like a really aesthetic guy. Like, is that kind of a good way to describe you? Like, do you like when you're going out for a date or something? Like the way you look is important to you, kind of thing.
No,
Oh, really?
Really, but I could see where you're coming from, and it's definitely not the case. I think I still have shirts from like 2000 I wear, and my wife is crazy that I do it, but I want to appear okay. Like I don't want to be insulting my patients, but yeah, I don't care about my
So
appearance more than that.
help me understand, what about this building drives you so nuts?
I think it's just
It's
more. It doesn't match the type of dentistry I want to do. Like if we're giving people really expensive treatment plans and we want to follow through with like the quality of work and all that, it's hard when they're sitting and staring at a stained carpet, which
yeah.
we don't have anymore. But still, that was only done like a month ago, so the feeling of that's still there.
Yeah, but like that's where the thing, like I'm really I think it's super important to me. And I don't know why, right? Like I'm a podcast host, but for some reason it feels very important to me that you walk into your practice every day with a sense of pride, right?
Yeah,
Like,
same.
and that's what's missing, right? It's like you're walking into your practice every day and there's a sense of dread. And the aesthetic seems to be a real thing. And I totally hear you. You've said the same thing twice now, which is I want to treat patients comprehensively. I want to be doing this high quality fee for service dentistry. And I want the environment in which I'm discussing this type of treatment with my patients to look and reflect the quality of my work, right? Did I nail that?
Yeah, that's perfect. So I think it's more not necessarily for me. I think I need to do it more for my patients.
Yeah. And
Yeah.
so maybe help me understand, if I were to walk through your office right now and you were to give me a tour, what part of the office in its current, I don't want to hear about the past carpet that's been
Yeah.
replaced with hardware. I want to hear about today, right? The office today, what is missing that is still not going to give that feeling to patients that like I can't get high quality dentistry done here. Look at this place.
Um, well, I still don't. We don't have like consult room, and I don't have an office. I sit behind the front desk, and I mean that's not fair to anybody. So that's really tough.
But I'm talking to you right now and I thought you were in your office.
Oh, so this is like an upstairs room. Once again, like the month ago when I bought the building, we were able to empty out. But before that, like we couldn't use it at all. It was so disgusting.
Okay, so now you're in an office. And so correct me if I'm wrong, so you don't have a consult room. Is that a big problem for you?
It's a huge problem because I know our numbers are fine, but we really don't have treatment plan coordinator, and that's a really important position to have.
Yeah. So, you know, yeah. And so do you have a room in your office that could be made into a consult room?
Unless it's upstairs, no.
Okay. Is there a break room?
Yeah, but that's upstairs.
Got it. Okay. Yeah, so then I would think that okay, so look, I can't make miracles happen. Right? So I think that from my perspective, like the thing that seems like the adjacent possible is presenting treatment in the operatories, which I'm assuming is what you're doing right now, correct?
Yeah, we're doing that now, and I mean, I'm going as much as I can presenting without getting into the actual financials. But we also are doing big cases, so I usually like to give them at least three options and run it through. And my front desk is great, but she's not at the point yet where she can necessarily leave because other than the floater, it's just her, and she's not fully able to answer like more of the clinical questions yet. So right now, what we're doing is I'll go over to the best of my ability of like what I treatment planned and why and the steps, and then she'll go in and present more of the financials and scheduling and payment plans and stuff like cherry and all that good stuff. But there's still a big disconnect because they should be able to talk more clinical than they are.
Yeah.
So
And
yeah,
I
we have.
think that this goes to number 3, which is systems, right? Like I think that yeah, ideally we'd have a consult room, right? That isn't an ideal world, and I think that we just don't live in that ideal world. We live in the world that we live in, and in that world you're probably going to need to get your treatment scheduled and your bigger cases in an operatory. You're going to have that conversation because you can't really do it up front when someone's standing on their way out. So I think that when you look at systems, right, having some type of flow to you either train up the front office team member on clinical natures, you're going to have to train up the floater to like swap with the front office, right? Like you got to get a flow down that your team knows that's the same every time. Because I think what you want is, I think that, so let me give you a little story here. So when I was an owner of a GP practice, I really focused on my insurance verification system. This was something I really obsessed on. And when it started working properly, I had this deep sense of pride. And I think that for you, where I want you to grow is I want you to grow in the sense of pride you have for your operation. And I think that that comes from doing the work on building it the way that you want it to go. Right. So I think that a great thing for you to do is to say, like, what is the way in which Scuba Steve's office does case acceptance for big cases? Because that seems to really matter. Then you think about, okay, I'm going to be here, I'm going to be doing this part. Then my front office is going to like build an ideal flow for your office and then train up who needs to know what to execute on that flow and then do that every time. And then my goal is if you do it that way, when you come into your office and you look at the schedule and you see like 2 consultations, for example, or like, just whatever gives you an idea that you're going to be presenting a big case that day, rather than feeling a feeling of dread, you can like have that feeling of pride of like, we're going to do it the way that I designed and it's going to be really good. And I think that that's kind of what's missing from this specific situation in my assessment is that like ownership over the process that you've trained your team on and they're following your prescription on how it needs to be done so that you have that pride walking in. What are your thoughts on kind of that maybe being an action item for you is like design the case acceptance process for those higher ticket cases. And, I don't know what we're going to do in what order, but like, let's just put that on the list as something that, I want you to tackle.
Yeah, I definitely agree with that.
Okay. So I'm going to keep going now. I want to talk about the vision and the goals. So that and the ideal patients. So like maybe pretend like, I guess maybe just tell me like what are your goals and visions for the office?
I still think there's people out there that are just looking for really high quality, comprehensive work, and it's my responsibility to explain to them. For example, if they had, a filling on number 9 that broke 12 times, maybe it's not the filling, maybe it has something to do with their bite. So I would love to sit down with the patient and say, yeah, I can fix that filling again. It's probably not going to last that long. Or we can start evaluating you comprehensively and looking at your bite and your alignment, your habits, and it will be a little more time and money up front. But I'm hoping once we actually solve the problem of why this filling's breaking, then over time, it'll be less money overall. Um, I think
So
that, yeah.
what I'm hearing you say is, do you feel like your practice right now doesn't have a comprehensive approach, a comprehensive mindset?
I think it's a battle between, I definitely have a comprehensive mindset, but it's a constant battle between, we want patients to do work. We don't want them to say no and not go to a dentist again for like 10 years. So we don't want to like scare them off. Being fee for service is very difficult with insurance because I want patients to know what they, are expecting financially, but we don't always know that 100% with fee for service, unfortunately. And my team is getting a lot better over the 2 years, but in the beginning, I initially didn't believe that they thought we were doing what's best for the patients. And that's really bad. And I've said multiple times, like, if you ever think a patient will be better off at a different practice, um, you have to let me know why, because I never think that's a true statement. So them seeing examples definitely help. All of them came from a non-fee for service practice. So I think they get caught up on the insurance reimbursements, but there's definitely things we can do for the patients to make it the same cost or even less money, especially because we do a lot of in-house stuff. I mean, if we're doing, I don't do all root canals, but I love I enjoy doing root canals. So if we're doing a root canal, I mean, that's saving a patient from going to a whole nother office for another exam, a root canal appointment, maybe another appointment for the root canal and a follow-up. So that's like 4 appointments where they have to go out of pocket and pay for everything when they potentially could do that in-house. And so the same quality. So I think once the more the team sees examples like that, the more they'll get what we're actually trying to do at comprehensive, or especially patients that literally have done their front teeth, 16 times with bonding, and they won't do crowns or veneers because of it's more expensive. But then we explain to them, well, yeah, but you just spent, $300 times 16 instead of doing one crown or one Invisalign case to fix your bite. So I think the more things they see of why we're doing it, the easier they'll get on board. And it's definitely not for every patient. That's why I do want to make sure I give them realistic options. Like, hey, this is textbook best treatment for you, but that doesn't mean in a real life scenario it's going to work for you. So if you don't like this or you don't agree, let's talk about something else to make sure you're happy and healthy.
Yeah. So I really see this, right? And I think have you ever sat down with the team and um tried to instill this type of comprehensive because like you can present comprehensive treatment options, and that doesn't mean that that's the patient's only option, right? Like if you can then go back and forth with them and figure out what's feasible and realistic in their world. But like, I think that have you ever sat down with the team and had like this type of educational experience, or just kind of like maybe got them on board with more of your philosophy?
Yeah, definitely not in the beginning. In the beginning, it was more survival, but now we have more breathing room, and we've had whole office meetings on explaining cases and why we think it's the best. And then, especially when case by case, when a patient comes in as well, we will say, like, listen, this is why we think we're better here. And I'll make sure I find the team member that would have some difficulty with that and definitely show them why. But that's more of a newer thing, definitely within the last 6 months.
Yeah. So, just talking through that, do you feel differently about this item, or do you feel the same way that like the team still is not on board?
Definitely not 100% on board, and it is getting a lot better though.
So, I think that for this one, yeah, let's keep going. But I do think that there's a vision reset that would definitely help you out, and I can talk about that a little bit later. So let's kind of go through. So we have one on your list was the look and aesthetic. We talked about that. Two on your list was your goals and visions, and that's really about treating patients comprehensively and your ideal patient. Um, and I think three, let's talk about systems. So where do you notice the most the lack of systems in your practice?
I guess when I'm walking out last and closing the blinds and windows and lights and making sure the compressor is off, stuff that as an owner it's your responsibility to make sure it's done, but it's really you shouldn't be the one doing it. And I think part of in the beginning I felt bad. I am a sucker, so I will do that stuff. And two, systems. I mean, there's no, and this is like the smallest example, but it's a good example. Like there's no checklist saying here's what we need to do when we leave the office. So I would say a lot of that, if not all of it's on me. And it's also tough too because I'm like, all right, let me just do it because I'll get it done faster. But I know that's just digging the hole deeper. That next time they're just going to expect that again.
All right, I'm very clear. And I think my last one is about the dull energy. Um, like, I guess, do you see anything that you could do on a regular basis that would maybe change the energetic environment of the practice?
I think by focusing on the top 4 or 5 bullets, it'll trickle down and just overall make the energy better. Especially if we have the same vision, I mean, everything's going to be better. And it's kind of funky to say, but go back to the other example where all we had was drama. I mean, these people that they hired to be 18, 19 years old, they would have no training. They would be running around, arguing with each other, fighting, whatever. But I could buy them, the whole office Dunkin' Donuts, and they would be like crazy happy for 2 more days, and that's how we would do it. Um, so I'm so lucky that we have a mature team where we don't have a lot of that little drama. But then there's also, I don't know what I can do for my team where I can just make them happy. And I mean, I think they're happy overall, but I just mean like fake, here's a lunch, here's a gift, here's coffee to make them happy.
I really think that man, if I was your team member, I would just want clarity. Like I think that I think you nailed it in what you first said, which is like if I just focused on the other stuff, then I think that for me that would go a long way to creating a better environment for your team, and then like tackle the other stuff and then reevaluate that question. Like yeah, you could do a monthly lunch or a weekly lunch or like whatever, right? But like I think that, the front desk would still feel overwhelmed and unclear on all the things and how to do them. And your consult, like all the little stuff that like let's make that better first. Because ultimately, like, you should serve yourself, in the process, and you should be thinking about your experience as an owner. And your experience as an owner right now is less than ideal because your team isn't really carrying the parts of the load that you need them to be, and that's not their fault. That's because you just haven't put them in that situation where they're required to do so with instructions. And so, maybe help me understand in your first 2 years of ownership, how much administrative load, like working on the practice, did you spend like on a routine basis?
Oh, way too much. I mean, just pretty much everything, changing the phone system, Wi-Fi, IT, marketing, um, teaching them how to. I mean, we couldn't pull a recall list. We couldn't even pull up overdue hygiene, and that's something I couldn't do. I mean, I could do it, but I was never trained on this system, so I had to learn all that before I can even teach my team. Um, I mean, so everything. And I know it was bad, but it goes back to saying like, hey, I just need to get this done so we can move on to actual dental stuff.
And I mean, in the last 6 months, what does that look like in terms of that workload?
A lot less, and I would say we finally have. I mean, we didn't even have an employee manual, and
Oh,
we
nice.
find, yeah. So we're like 99.9% done with the employee manual. So at least because it's not fair to a staff member if I expect something for them, but they don't know what it is, or they can't go back and reference what they need to do. So that wasn't fair initially. So now that we're pretty much have an office manual, we just need to finalize the last little bit. At least they have a spot to go back and find their roles and responsibilities. Or especially when we hire a new assistant or another hygienist, they have a reference to go back to because it's not fair to them if they don't know what is expected of them.
Yeah. So, Scuba, I think the thing that's really coming to mind for me is um, you kind of talked about this at the beginning of maybe middle of part one, but it's really coming up for me right now, which is like you hit a goal and then you're like kind of all dialed in on the next goal. And I I think that maybe it is going under discussed just how much progress you've made in the last 2 years. Like mountains of progress, right? I mean, every time I talk about something historical, whether it's the facility, the employee handbook, marketing, IT, all this stuff, you've made mountains of strides. Like when you're going on a long hike and you're looking at how far you have to go to the top of the mountain. And then like you maybe take a minute and you turn around and you're like, oh shoot, I came quite a long ways to get to where I am right now. Um, to me, you strike me as the type of person that doesn't do that very often. Because I'm in our conversation, I'm having a greater appreciation for how much you've done so far in 2 years.
Yeah, I mean, once again, spot on. And I don't know what it is. I don't think I need that as much as an average person, but I think my team needs to see me need it. And that's where I really dropped the ball because I didn't really care as much about me because I cared about the practice and my family. And I didn't realize by me doing that how much of a direct effect it would have on the team. Um,
So can I give you some? Can I give you like one main item that I'd like you to take away from here? So, do you do like a month with your team, um, like just on any particular basis, like just kind of like any routine get-togethers with your team?
very small. Then it's not really every month. It's do a dinner here or very small. Nothing like great yet.
So, I'd like you to schedule a next one, and I'd like the theme of it to be where we've come and where we're going. And I'd like you to take the first bit of this time to do what your team needs, which is acknowledge all the progress that has been made to date, and say like, look, when I bought this, we joke about the rat poop. We talk about this. We say, look at this now. Look at how far we've come, and just like take a minute to like deeply appreciate all of these small things. Like we now have an employee handbook. We now have this. We're no longer doing this. We now have a website, the phone system, like all of the stuff that they know and they've lived. Just say like these are all the things that we've done. And then, like, that's part one of this meeting. And then part two of this meeting is this is where I want to go. And I want you to talk about that feeling that you have when you walk in of the office and how you want to walk in and feel pride for the type of dentistry that we're doing and really emphasize this comprehensive dentistry piece. I think that's the piece that, like, from a team's perspective, that's like your next frontier of leadership is getting them on board with at Scuba Steve's office, we treat people this way and we take pride in it. And like the whole team needs to rally around that, right? And it's like having this like reset button for your team and say like, all right, to date, we've done a lot of surviving and it's been excellent. And we've made so much progress. And now like the next step is for us to treat patients in the way that I deeply believe is the best way. And, really let your passion for comprehensive dentistry kind of unfold as you're having that conversation. And then what I would like you to do is make a list of, something that I do is like if I have a monumental project like this, like I have to systematize the office, I've got to get a consult process in place, I've got to do I've got to get comprehensive dentistry, I got to, all the things that you might think are to-dos from here on out. I'd like you to put them on like a central piece of paper and then start seeing that you're going to start crossing stuff off and then have an appreciation for that when you're doing it. I feel like, honestly, where you're at, I feel like if we had never had the interview and you were to just keep going, you'd kind of be just fine. Like you're just making progress kind of steadily, just knocking things out as you go. And I think the thing that I really want to provide is an intentionality to what you're doing and why. And then also an appreciation for the journey and where you're coming from and going. And then I think that shared practices can help you a lot with the team organization aspect and the systems and getting roles and responsibilities and getting people to behave a specific way. Like all of that team training stuff, like that's kind of our bread and butter. But like from my perspective, I really think it's a meeting with the team, having a reset, appreciating the past, and then setting a guidance for the future. Like they need to know that this comprehensive dentistry piece is super important to you. And then I think it's a matter of getting a list and starting to strike through it and watching yourself strike through things and having maybe a different relationship with that. Like, oh, nice. Like we've made progress. Good. Like I appreciate that step. And now I go on to the next one. So that's kind of like, where I would kind of point you to moving forward.
Yeah, I'm definitely going to do that. I like that a lot.
So, we're kind of coming up on time. So I want to recap just a bit for our audience, and then I want to kind of give it to you to see if there's any lingering questions or anything else that you want to talk about. But I think that, like, for me, of everything that we've talked about between the two parts, the thing that I find the most, like, the chief complaint that I would call it is the not loving your practice. And I think that you've done so much work, right? It's not like you're an owner who has just focused on producing and going home, right? Like if that was you, then I would be having a conversation saying like, hey, you need to focus on building the business a little bit. You need to be focusing on the ownership, working on the business, not only in the business. But I think you've pretty consistently worked on the business. And I think you have a habit of working on the business. So I don't think I need to really help you there. And I think that where I think I can help you, and where I'd like to you have to kind of have your takeaways from this interview, is what you focus on being targeted towards that feeling that you have when you walk in the office. Like I want you to walk into the office and say, I'm on my way to loving this practice, and this is what I need to do to get there, and I'm going to strike through these items. And every time you strike through an item and you walk in, you have a little bit less dislike and a little bit more appreciation and pride. And I think it's that pride that I'm like really trying to instill in you. Because like the building is going to be the building. The lack of consult room is going to be the lack of consult room. But like there's something about private practice when you imprint yourself on it that like you have this sense of pride of what you've built and what you've done. And I think that's where like I think is your next frontier, along with systemization and organization and having the team be on board with your vision of comprehensive dentistry. Like I think kind of all of that is really where I see your next steps.
Yeah, I agree. I mean, looking back, I still love being an owner. I really don't think there's any other option for me. But I am definitely doing way too much of the business side of it. But that's also on me because I didn't really have the systems in place initially because I just want to do it myself and get it over with.
Yeah.
I am lucky though because I really do love clinical dentistry still. And I almost joke with my front desk like, hey, we have really good days when I'm go from op one to op one, op two. I can't be up front messing some stuff up and trying to help, but really making it more difficult for people. Like we are the best when I'm just doing dentistry and nothing else. So I think these are really good goals to strive for because it'll also be less stress for me overall too.
Totally. Absolutely. And so, Scuba, do you feel like you're kind of maybe clear on your next steps? Maybe just kind of give a takeaway for the audience. Like, what is kind of one of the biggest things you're taking away from your experience on Practice Underwater?
Um, yeah, just being more clear. I think the best thing about coaching, and I am like just so guilty of it. I can give all the correct advice to anybody in the world. I just can't take it myself. And it sucks, but it sucks a lot because now we're not only affecting me, we're affecting, the people who work for me and their families and the patients that see me and their families. And I mean, this is the real deal. So I think just having someone to talk to and coaching and actually hold you accountable for these things is the biggest difference. And it's so important and it really just needs to be done.
Yeah, totally. I'm really happy you came on. And, I think that it's one of those things that like, I almost feel like sometimes on Practice Underwater, we're talking about all the stuff that needs to improve and all of that. And we forget we bury the lead of all the things that are going well. And that's really kind of like, for me, what's kind of occurred maybe in the second half of part two is like, you bought a practice doing 500 to 700,000 and you've collected 1.3 million every year the 2 years that you've owned it. And so like, that's excellent. And then you think about, your income, excellent. The fact that you own the building now and you're improving it, excellent. The fact that you have like a habit of working on the business routinely to improve it, great. Now, I think you have a lot of room to improve your delegation and make your team carry more of that load, right? That's the improvement side. But like, you just have you've done so much that I think it like, you have a lot to be proud of as well. And so I don't want that to go unnoticed. But then at the same time, I think you got a lot ahead of you in this next step, which is really getting the team to carry that load and having that transfer to being, scuba-led success to team-led success. And I think that's really your next frontier. And you have to make sure that that team is team-led success with Scuba's philosophy of comprehensive dentistry. Like that's your next step, is getting the whole team to carry the practice load with you, with your vision as the thing that they're carrying forward. And, I think that that's going to be a big thing. So thanks for coming on. I really hope our audience got a lot out of this. And thanks for listening to another episode of Practice Underwater. Thanks a lot, Scuba.